Compliments of the season to you, our wonderful viewers of Etafil and AIT. It is good to know that despite all odds, you are still forging ahead. I am your regular anchor, Shomo Wadanis, and today we are revisiting the situation of tuberculosis, commonly known as TB, in Nigeria. We'll be right back after the news segment. Please don't go away.
A gathering of friends of Dr. Paul Enebeli at Marriott Hotel Ikeja, Lagos, southwest Nigeria. It became necessary to celebrate the conferment of the Doctor of Science honoris causa on him by the University of Benin.
We are here because the Lord has been very kind to one of our senior professionals, Dr. Paul Osogbe Enebeli, who had just been honored with a DSc honoris causa by the University of Benin. Here is a man who has devoted all his adult life serving the profession of pharmacy.
He has mentored so many of us and is still mentoring so many of us. He has been the president of University of Benin Alumni Association. He has been chairman of Board of Fellows of the Pharmaceutical Society of Nigeria. He has been a member of the board of NAFDAC and so many more that you can mention. That someone like him has been recognized by no less a distinguished institution like University of Benin and make us proud. It is hope. It is inspiration for young pharmacists to know that despite the trouble of the environment, we still have people who are signing example, who have shown the way, who have led the way, and who have proved to us that, look, there is no height that you cannot attain.
I wish my dad very well, and I'm happy for his achievement because over the years I've seen his commitment to humanity and service. He's someone who we admire, he's someone who has trained all of us right, and I'm happy that we are on our own part to have made him proud.
I feel very humbled and I'm short of words, but I thank God.
The thoroughbred professional from Ndokwa East local government area of Delta State, according to many, has a heart of gold and has served humanity in many ways.
These are the people we see that made us to venture into leadership. And up to today, he has always been encouraging us. He has always been with us during the thick and thin.
Pharmacist Paul is an outstanding personality, both in terms of professional practice, in terms of contribution to society, and in terms of impact he makes on lives. He is one person we all look up to.
Testimony people are giving about Paul, if you listen carefully, he touches lives of everybody. And that is why we are celebrating him today. He is touching life, he's a mentor, he's a helper, and he's blessing people.
It wasn't possible for Health Affair crew to be in the midst of key players in the health sector gathered here without raising issues about the healthcare delivery challenges in the country.
What I want to say is I want to advise them to keep hope alive. Once you become hopeless, then there's no progress. They should keep hope alive. This country is a very beautiful country. What we lack is leadership.
One of the most primary problems in the health sector is the problem of medicine distribution. And government has not paid attention. For over 3 decades in this country, there have been open drug markets. And with open drug market, you get substandard medications. With substandard medications, you know that people will not live good quality of life. The quality of life of the people will be impacted because no matter what they do in the hospital, no matter the diagnosis, the test that goes into it, most of the time it ends us with the use of drug. And if we are not paying attention to the quality of those drugs, the quality of how they are distributed, then we are not just doing the right thing.
Doctors in Lagos State have challenged government at all levels to take the response to brain drain challenge beyond the headlines by providing adequate support system for those given the assignment to save the lives of other people. The doctors said not less than 15 of their members have died in the last 6 months, with many requiring medical intervention, for which they have so far spent 21.5 million naira.
Everything in the environment that applies to any other human being applies to the doctor. I won't be quoted, but you don't want to know what is the percentage of doctors treating you with hypertension themselves. Mental overload. Prayers alone don't stop people from dying of illnesses that could be better managed or even prevented if there is enough decisive support system. So nobody should say that the commitments of government are so plenty. It's only people who are alive that are going to ply your roads. Dead people don't know go slow. They are dead.
The 2023 World AIDS Day, with a theme Let Communities Lead, has provided the opportunity for renewed calls by stakeholders to increase awareness and commitment to the global fight against HIV and AIDS to end the epidemic within Nigeria's borders. Reports by the UN AIDS 2022 Spectrum show that since the last population-based survey in 2018, the burden of the disease has grown by 7.2%.
The people living with HIV and AIDS, we need their community to come out, let them people know that okay, it is not HIV is not a death sentence. We can come together and fight HIV and AIDS.
We need more support from government. We also need people to be responsible. That AIDS is also, and of course, AIDS is real. And it's still there. We need to be careful.
Director General of the National Agency for Food, Drug Administration and Control, NAFDAC, Professor Mojisola Adeyeye, has assured Nigerians of an enjoyable festive season by ensuring that fake and substandard products do not find their way into the market. Professor Mojisola Adeyeye made this commitment during the program to address issues of leadership, ethical values and corruption practices at workplaces in Lagos.
This Christmas is going to be a blessed Christmas for everybody. That doesn't mean there will not be fake products in the market. If there is no deterrent, people will bring in fake products. But we are making it hard now for people to bring in fake products. They do the crime, they do the time with our sanctions.
In line with the World Health Organization, WHO Quality Safety Benchmark, ISO 19004, Adeyeye urged staff of the agency to be transparent in all their dealings to safeguard public health.
Without transparency, our regulatory activities will be compromised. If we don't do our job well, we will allow bad products to come into the country. Working in NAFDAC is not just 9 to 5. It is changing the narrative for many people, for our country, bringing the pride back, reducing the shame.
Tuberculosis, TB, is the second leading infectious killer disease globally, a situation that has led the World Health Organization, WHO, to set some milestone targets of eradicating the disease by the year 2025. Let us hear how Nigeria is faring.
According to the World Health Organization, Nigeria is one of the 14 countries that account for about 80% of the global burden of tuberculosis. Also, Nigeria as a nation is one of the 30 high-burdened countries with drug-resistant tuberculosis. It also has an incidence of about 219 cases per 100,000 population. The country also ranks about the 6th in position globally and is the first in Africa of 4 countries with high disease burden of tuberculosis. Lagos State specifically, the program has notified about 17,280 clients as at last year. Currently, it has notified over 13,800 clients so far since January till September, when we have a reliable and very clean data. Despite the progress we have made in the recent years, there is still much work to be done in the program. You agree with me?
That's why we are, as a national program, we are strongly thinking of having a national prevalence survey, national and subnational prevalence survey on tuberculosis, because the last time it was done was a decade ago in 2012. So in fact, we should be able to have that survey to be able to rank the states according to the burden. So, but before then, we need to, because it's a very infectious disease. So we do not want to waste time, because it's on record that one unintervened case has the capacity to infect not less than 15 people in a year. So if we leave one case this year, by the time you come back and say, you see that we have been multiplied by 15. So every hand is on deck to make sure we cut that chain of cases. And the best thing to do is for early detection of the cases place them on treatment, and let them take for 6 months. That's a sure way of cutting the chain of transmission and then liberating Nigeria from the burden of an embarrassment of tuberculosis.
Tuberculosis is a bacterial infection that affects the lungs. It spreads through the air when infected people cough, sneeze, or spit. Though tuberculosis is preventable and treatable, a total of 1.3 million people died of the disease in 2022.
The major cause of tuberculosis is what we call Mycobacterium tuberculosis, and the major signs you get primarily is cough. Chronic cough is lasts for more than 2 weeks or more. When a person is coughing for more than 2 weeks or more, he needs to go to assess it in the hospital. You can also see things like weight loss, night sweat. Even when the weather is cold, the person is sweating. Some people will even cough to the point of coughing out blood. So it's important that we allow the society. Then you see people with fever, but the fever does not go. Even when after treating malaria, they have a low-grade fever and all that. So these are some of the cardinal signs you can see when you are talking about tuberculosis. Poverty has a high impact in tuberculosis because that's when the immune system of people gets low. So when people's immune system are low because they are not eating the normal nutritional food they're supposed to eat, then there is likelihood that they will develop disease. And we also know that tuberculosis is through the air. So everybody can breathe it in, but those who can actually manifest it are those that their immune system are low. So actually, most of us has the bacilli in our lungs, but it's not actually because our nutrition, our immune system are actually suppressing it because it's strong. But for those who are not able to have adequate feeding, good nutritional values, who are sick, those who have HIV, those who have things like diabetes and all the rest, or even those who are taking drugs that are attacking their immune system, they are likely to develop more of this tuberculosis than the whole community. Then children are also more at risk.
The government of Nigeria, with support from donors, they are doing a lot in terms of making different tests available to detect the tuberculosis and then to treat those people that are positive for tuberculosis. But many people don't know about the efforts of the government. They don't know that testing is free. They don't know that treatment for tuberculosis is free. They don't know that there is a hotline you can call that is called 3340 that you can call and you can get more information. You can even get the direction to the nearest TB test around you, but many people don't know. So that's what Breakthrough Action will support the government of Nigeria to do.
To end TB in Nigeria is a collective effort. The UN high-level mission on tuberculosis has just come and gone, and they have set a broad objective and requested countries to take bold steps and decisions at the national level. I think for us in Nigeria, it's the way forward for us to take those bold decisions. But as I speak, Nigeria has made very significant progress in achieving some of our targets. But there are some specific areas that we still need improvement. For example, in increasing our childhood TB case notification and also increasing our drug-resistant tuberculosis notification, and also ensuring that people that are eligible for TB preventive therapies are placed on TPT.
The access to treatment in Lagos is fantastic. So we have over 1,400 dot clinics spread across all the 20 LGAs in Lagos. So if you have anybody in your community that have signs related to TB, person can report to the facility near him or her. We need to have people more campaign to ensure that we know about the signs and symptoms of TB, so that if you cannot eradicate TB, at least we can reduce TB.
If you are just joining us, it's Health Affair on AIT. On our clinical segment, we give you tips for healthy living.
The food that one takes, it determines what goes on in the body. If you take natural food, organic food without chemicals, food that have not been preserved, that are not dead food, we're talking about living food now, it helps your body to stay out of cancer because your body is a living cells. If you are now putting preserved food, inorganic food into it, it's like putting dead food into a living body.
This is where we draw the curtain on the program today. Please join us same time next week on another interesting edition of the show. I am yours truly, Ushomo Wadanis, wishing you a Merry Christmas and a prosperous New Year in advance.